Hi, my name is Mark Rose, and today I will be talking about the ethics of euthanasia. The purpose of this is to inform you about a very divisive topic today and to challenge your morality because it makes you a better person. Some points I'll be going over is euthanasia and its types and arguments for and against it. Some things to be aware of before looking at the arguments is what mercy death and mercy killing are. Mercy death is assisted suicide with consent, and mercy killing is taking life without consent. Brain death is normal heartbeat and breathing, but irreversible death or brain damage. Criteria for brain damage is being unreceptive, unresponsive, no spontaneous movements, or breathing, no reflexes, and a flat EEG, which is pretty much like a measurement for brain activity. Another criteria is being in PVS, which is persistent vegetative state. It's pretty much damage to your cerebral cortex, and it's not brain death, but you lose most of your function, so it kind of is. But another thing is extraordinary and ordinary means. So this is pretty much how patients are treated for this. Well, not brain death, but anything. Extraordinary means is to keep people alive, but it involves a great burden on the patient or another person. This includes radical surgery, radiation therapy, respirators, heart machines, and most of these stuff are used just to prolong death. Ordinary means is helping a terminally ill patient without prolonging death. It's mostly used to control pain and make the patient comfortable. And this includes like hospice or like pain medication, stuff like that. Something that's kind of considered euthanasia is letting someone die. So arguments for it are shortening the period of suffering so they won't be suffering as long, and it gives them the right to die with dignity, which is arguable. But some arguments against it is it's abandoning the patient, and never to choose life over or death over life, and it interferes with God's plan. There's a case that I have in my philosophy book. A 38-year-old nurse gave birth to a baby girl who had both Down syndrome and intestinal blockage. This type of birth often occurs in women over age 35. The nurse and her husband agreed that the child's existence would be poor in quality because of her mental retardation and knowing that she would die if the intestinal blockage weren't removed. They refused to sign a permit for surgery to remove the blockage and told the doctors to do nothing to save their daughter. The doctors in the hospital agreed that the parents had the right to make this decision, so the child was left in the nursery to die. After 11 days, she died of starvation. It's a pretty disturbing case, and there's a lot more like that in this book, but cases like that make you question what's right and wrong, and it's hard, but it's a very hard topic. Now, some arguments for mercy death, which is assisted suicide but with consent, is everybody has individual rights and freedoms. So you have the right to die, you have the right to do what you want with your life. And then human rights and animal rights. So if you would put a dog down, wouldn't you put a human down if they were suffering too? Some arguments against it is it's irrational, or it's like in the moment kind of decision. There's a religious argument where it's like the same as suicide. The domino argument, which if it were allowed, then soon would mercy killing, which is pretty much the same thing but without consent. And the justice argument, which is asking someone to kill you or kill yourself places a burden on that person. And it kind of eliminates the possibility of finding a cure. So if you decide to do that and a cure comes out like a week later, then yeah. But then there's mercy killing, which is assisted without consent. And some arguments for it are mercy for the living dead, which technically is like the patient isn't fully alive, so it's not as bad. There's the financial and emotional burdens to their families argument, and that one's pretty self-explanatory, but there's no argument that if the patient could speak, they would want to die, which is definitely arguable, but they also have their own individual freedoms and rights, like I said before, and human rights versus animal rights, which is if you put a dog down, you put them down. But some arguments against it is pretty much the same as mercy death, but it's against patient's will, and that's it's hard because they can't express their will. But if they could, I don't think everybody would want to. There's a case about that. Laura, a 19-year-old woman, fell into a coma because of an overdose of drugs and alcohol. She was given emergency treatment at a hospital and was placed on a respirator, which stabilized her breathing. She remained in a deep coma, and when she was tested by neurologists and neurosurgeons, it was discovered about 70% of her brain was irreversibly damaged. She was not brain dead, but she reacted to pain. Her eyes sometimes would open and her pupils contract. She would at times thrash about, and her EEG showed some brain activity. She was in PVS because she could not be pronounced dead in any medical or legal sense. The hospital and the doctors refused to take her off the respirator or stop any other treatment they were giving her. At one point, Laura's sister was alone in the room with her, and thinking that Laura wouldn't want to live on this way, she disconnected her respirator and caused her sister's death. This isn't by doctors because there's very little cases where mercy killing happens because it's not legal, but the cases that do exist are usually family members or friends or whatever, people that know them. So in conclusion, mercy death is suicide with consent. Mercy killing is taking life without consent. Euthanasia is a very divisive topic, but it's important to know the arguments for them and to challenge your morals. Thank you for listening.